Hemophilia,
By Angelico Salvador.
and Aaron Gonzalez. Hemophilia is a disorder that is usually inherited and caused due to a mutation in one of your genes. This bleeding disorder makes it hard for your blood to create clots whenever there is an open wound. This is extremely dangerous because even a small cut can cause Stacy to bleed out.
A karyotype is more applicable to your case in order to show the baby's chances of their X chromosomes being affected. The diagram would show the baby's chromosomes and whether they would be a carrier or be afflicted by the disease.
Is a karyotype dangerous for me?
It is completely safe to have one done. We would need a lot of collected data about your family history in order to do it.
Is it dangerous for me to have a child?
Yes, it comes with risks that the baby and you may be harmed. There's an increased risk of excessive bleeding when having the child for you and the baby.
Will insurance cover my costs?
Yes, Medicare and Medi-Cal cover most of your treatment plans.
What are the chances of my baby inheriting my disorder?
There is a 50% chance your child will inherit the disorder. Since you have a dominant gene, if it's a girl, there's a 50% chance she'll get it since she will have a backup X chromosome. And if it's a boy, the chances are higher that he will get it since he only has one X chromosome, and it's more likely to be affected. Regardless, further testing will be required to confirm the disease. One should take a sample of the baby's DNA right after birth, and it should be repeated 6 months after birth.
Also, one of the genetic testing options we can offer for this disorder could be factor assays. Since you're looking to have a child, the best options are to have it naturally conceived, have a gamete donation, or looked into adoption options. Although one of the major risks of conceiving the child yourself is that you are prone to the risk of bleeding out after delivery.
There is also the risk that if the child does inherit the disorder, once they are born, they are at risk of the intracranial hemorrhage and extracranial hemorrhage, and possibly other bleeding complications. We also recommend to continue having your annual checkup at a hemophilia treatment center for a better understanding of your disease and how it has progressed.
Thank you for all this information and your time today. We'll be sure to contact you if we have any other questions.